This is Eli. He is a typical Yaley. And oh man, Eli's got some studying to do for his human sexuality midterm. But, speaking of the typical Yaley and human sexuality, let's educate Eli about his fellow classmates first. A recent YDN article found that 90% of Yale students have made out with someone, 75% have engaged in oral sex, and 64% have had sexual intercourse. Just in the past week, out of the 20 people in Eli's section, half of them made out with someone, 6 had oral sex, and 6 had sexual intercourse. And that's great. It means people are having a good time. But keep in mind, there are some serious issues involved. Here are some basic facts about STIs. 41% of sexually active students at Yale have never been tested for STIs. However, 3 out of 4 sexually active people will contract an STI by age 25 in the US. Common STIs include the human papillomavirus, chlamydia, gonorrhea, and herpes. In the US alone, more than 50 million adults have genital herpes, and 1.6 million new infections appear each year. This means that by 2025, up to 40% of all men and half of all women could be infected. How much of this involves Yale College? Well, over a quarter of syphilis cases, 63% of gonorrhea cases, and over 70% of chlamydial infections occur in college-aged students. And by far, HPV is the most common STI on college campuses nationwide. Over 60% of all women will be tested positive for HPV during their college years. And condoms provide virtually no protection against the infection. STIs can lead to some serious consequences. Left untreated, HPV can turn into cervical cancer. There is no cure for herpes. If untreated, it can spread to sexual partners undetected. In a study done on college campuses, half of respondents indicated that they could tell if someone had an STI by just looking at them. However, 75% of women and 50% of men show no symptoms for chlamydia. And for HPV, the most common symptom is that there is no symptom. It can take up to 10 years for symptoms to appear. All sexually active young adults should get tested every 6 months or every time they change a sexual partner, whichever comes first. Getting tested should be just as routine as a dental checkup. The Sexual Literacy Coalition at Yale has teamed up with the New Haven Community Health Care Van and New Haven Public Health Department to expedite this process. All you have to do is come to the AFAM house on February 9th, 13th, or 14th for immediate STI counseling and testing. Be happy, be healthy.
Se pasó, Faro.